Hello, everyone. I'm Joan Everett. I'm a writer and researcher at Women's Health Network, and we're very glad you're joining us. Today, we're talking about one of our top areas of expertise, menopause. We have three of our practitioners and members of our expert panel to talk about what every woman needs to know about menopause so she can have the best experience possible. We have our naturopathic doctor, Dr. Sharon Stills from Arizona. Hi, Sharon.
Hi everyone, nice to be here.
It's great to have you. Joining us from New York is Dr. Susan Brown. Susan is a medical anthropologist and certified clinical nutritionist who specializes in osteoporosis and natural bone health. Hi, Susan.
Hello, nice to see everyone.
Thank you for joining us. And from North Carolina, naturopathic doctor, Dr. Mary James, also joins us. Hi, Mary.
Hey everybody, nice to be here.
So glad you're all here with us to talk about something that's very important to every woman. So let's jump right in. I'm going to start with you, Mary. I'm hoping that for everyone listening, you can define menopause for us and share your thoughts with us as to why you think women might dread it so much.
Well, technically, a woman is considered menopausal when she has not had any periods for a full year. That can vary, but that's the average. And the average age of onset of menopause is around 49 or 50. And I find it really interesting in light of the fact that as recently as 1900, the average life expectancy for women was about 50. Today it's around 80, so we're seeing a lot more symptoms today than we ever did, including menopause, just because we're living longer. As for why women dread it, I think we've been conditioned in our society to worry about being over the hill and being all dried up when we hit menopause, and that doesn't have to be the case, as we'll be talking about, I'm sure.
I'm going to flip this over to Susan quickly to ask you, why do you think women might dread menopause? It's such a, there's sort of a stigma attached to it, and it's got sort of a bad reputation. And
Well, I think that's all a mistake. Actually, in many cultures around the world, menopause is considered really a great time when women are freed from those burdens of having periods, of having children, of having this whole reproductive responsibility, and also they're free from the possibility of getting pregnant. So my favorite culture is Botswana, where the major symptom of menopause was increased libido, because women felt, wow, now it's a whole different stage of life. We have a cultural perception of menopause as being dreadful, partly because of our whole phobia of aging, our unwillingness to accept that natural cycle of maturity. But that can be a real time of flowering, a time of freedom, a time of independence, and even physiologically, you're not losing blood anymore. The Chinese understand that this is an opportunity to build strength for the second half of your life. So I think menopause can be signaled as a great opportunity for freedom. What does happen is about 25% of the women have a very difficult, in this culture, have a very difficult menopause. And that kind of sticks in our memory, the person with a lot of hot flashes, a lot of emotional disruption. In fact, Geraldine Pryor, one of my favorite endocrinologists, has a wonderful book on this called The Estrogen Storms for the person who's going through a real difficult menopause. But for another 25%, it's a very easy transition. And for every woman, it signals an important new stage of life.
well, I think that's encouraging. Sharon, let's talk a little bit more about these symptoms, because this is one of our missions here at Women's Health Network, is to help women with their menopause symptoms. What do you think, and what have you seen in your practice, is the most common and troubling symptoms of menopause?
Well, I think what brings many of you who are listening to a physician such as myself or searching for answers for symptoms would be the common hot flashes or night sweats or low libido, mood swings, vaginal dryness, headaches, memory loss. There's just a list of on and on: depression, anxiety, headaches, joint pain. And so anything that you're experiencing, I think what's really important for all of you to know is that it shouldn't be dismissed, that there is a solution, and if you are in that time where you're going through menopause or you're perimenopausal, which is the state before you actually are in menopause. So there's perimenopause, which is leading up to that definition of menopause, which is the cessation of your period for a whole 12 months. And then there's postmenopause. So there's actually different stages. And these symptoms can follow you through all of the stages.
So I think that that's really true. Also, we have sort of a spectrum, I think, for menopause. So Susan, you were talking about some people have it easy and some people have it rough, and then in between are the rest of us who have some symptoms and some issues, certainly. I wanted to ask, Mary, I'm going to go back to you. We hear a lot that no two women have the same sort of experience in menopause. Do you really think that's true?
To a certain extent, yes, just because we're all unique. We have genetic differences, we have environmental influences that are different from each other's. We're different people, but certainly there are characteristic menopausal symptoms. So, if there's a few women friends talking with each other and one says, oh, I'm having a hot flash, almost inevitably the others, if they're also postmenopausal, will say, oh, God, those hot flashes, I know what you mean. I mean, third one, if I can't go through another night with another hot flash, I mean, there are certain symptoms like hot flashes, night sweats, waking up, trouble sleeping at night that are very common. So to some extent, I think there is quite a bit of commonality across women, but that uniqueness makes for a lot of differences. For instance, there was a study that looked at migraine in postmenopausal women, and in that study anyway, the only women who experienced migraines were the ones who had migraines with PMS when they were premenopausal. So there's something about unique predispositions to problems that seem to strongly influence how our menopause years look.
Let me just jump in here because I think that's a really important point, and it ties to what Sharon said. Preventing menopausal disruption really should start much earlier in life, and when you have difficulty with your menstrual period, it means that there's an imbalance in this network of intelligence in the body, and an endocrine imbalance, and you're much more likely to have menopausal problems. So it's great to think about young people, and if you are in youth, if your menstrual periods are not, if you have difficulty, a lot of PMS, that's the time, like Sharon says, also to go see a physician and a person who might help you with natural remedies, Chinese medicine, homeopathy, whatever, because it's great to correct the imbalance at that stage. It'll make menopause much easier.
And I think that that's a very helpful recommendation, because if you don't know, you're not going to do anything about it, or if you think, well, this is just the way it is, I've got PMS. And I also happen to know from working with you, Susan, that it is the best time to start really paying attention to your bones when you are a young woman, and just being aware of the kinds of things and behaviors and the things that you're going through in order to begin giving your bones what they need way earlier on than before you're at the, on the cusp of menopause.
Exactly. It's very right.
I'm going to throw this out to all of you, but maybe we'll start with you, Sharon. What's your best overall advice for alleviating menopause symptoms? I mean, if you had to say one, two, top three things, what would you tell a woman who walks into your office and asks for help?
Well, typically when someone comes in, or if someone is concerned about menopausal symptoms, I invite them to start, first of all, just acknowledging that this is an opportunity. It's an opportunity and a passage into the extraordinary wisdom that we all contain within us. And so, as we've been talking about, if you are having symptoms, it just means that there's an underlying imbalance. I think it's really important that we have a sense of humor, because if we can't laugh at ourselves and laugh at what's going on, it's going to make the transition a lot more difficult. I think some of the things that you can do for yourselves just to start bringing balance into your life, I start to think about traditions from Ayurvedic medicine. And so one of the things is just having routine in your life. It's been shown that when you're going through hormonal changes, if you get to bed by 10 every night and you wake up around 6 and you do that consistently and you eat your meals at the same time and you exercise and you meditate and you give your body rhythm, then the hormonal rhythm in your body is going to fall in suit and it's going to balance itself out. So I think that's very important. I think it's important to not just go chasing symptoms, but to really look at what's going on in your life. And of course, if you are having hot flashes, you can start to do things like drinking cooling teas, eliminating alcohol, eliminating caffeine, eliminating spicy foods. You can utilize color therapy. It's actually been shown that the color blue has anti-inflammatory properties and is soothing. You can paint your bedroom blue. You can get blue blankies to wrap yourself in. You can wear blue colored glasses. So you can start to explore and have some fun with this transition. And most of all, I think it's just really an opportunity to say, yes, I am entering into a new stage of life, a stage where Susan was saying, I don't have to worry about if I get pregnant. My children are probably grown. And as we talked about the other day, Mary had mentioned you can start to say no. And I was thinking about that. Most importantly, when we say no, that gives us the opportunity to actually find our yes. And what are we passionate about? And this second stage of life is that time where we can really stop caretaking others and start caretaking ourselves.
I think those are, may I throw something in here? First of all, Sharon, I think those are wonderful points, all of them, and I especially love the one of embracing this transitional time in a very positive way instead of going into it with fear of all sorts of symptoms and feeling lousy. One thing I wanted to add is that is the impact of stress, speaking of that roundtable we did on stress, the impact of stress on menopausal symptoms. A lot of people don't realize that all of our steroid hormones come from the same place. I mean, ultimately cholesterol is the starting molecule, but then there's intermediate molecules and hormones, and all of them can either go in the direction of stress hormones or they can go in the direction of DHEA and other male sex hormones, androgens, and then estrogens. And so whenever we feel stressed, when our bodies think that we're in an emergency, those starting hormones, the precursor hormones, instead of going off to DHEA, which is very supportive to our well-being and anabolic functions like immune function, libido, all sorts of things that take a backseat to stress, and the sex hormones, those starting hormones go to cortisol so that we can handle stress. And if we keep that up, then it's like robbing Peter to pay Paul, and Paul, the sex hormones, really suffer. And I think a lot of women who've had chronic stress, especially to the point of having adrenal fatigue, where the adrenals are just kind of whipped and they can't even produce those starting hormones anymore that make the sex hormones after menopause. We don't have, those women with adrenal fatigue don't even have the building blocks for that, and they tend to suffer, I think, the most.
Yeah, I think that's a really excellent point about strengthening the adrenals, and Sharon's points about the kind of the way you nurture yourself during the stage. It's so interesting when you look cross-culturally, because in many cultures, in Japan, they didn't even have a word for hot flashes. I remember talking to a woman from Sri Lanka, and I asked her, do you have these hot flashes when your period stops? She kept asking me, what's it like? What do you mean? She said, well, no, my aunt never talked about that. My mother never talked about that. We don't talk about that. We don't experience that. It's a very, in some sense, our imbalances are quite cultural bound and largely related perhaps to that stress syndrome that we're all so subject to. I do find some really helpful things like doing an alkaline diet, really getting all those fruits, vegetables, nuts, and seeds that allow you to have plenty of minerals and plenty of precursors to remove any excess acids and detoxify the body. To look at this whole idea of superfoods that can really help, particularly cooling foods, like goji berries, for example. In the Chinese system, these hot flashes are like a yin deficiency. Yin is like the cooling element. You like lack cooling element. So things like cooling foods like watermelon, celery, citrus, and actually goji berries are really a nice remedy to make a little tea of those goji berries to reduce the heat within the body. It's also interesting that exercise can be a big help. When you look at the studies on hot flashes, it's hard to do a study on menopause because placebo is many times as effective as the treatment because it's partly the intent, partly what you're expecting. In some ways, I like to remind us of Deepak Chopra's favorite statement that expectation dictates outcome. Now, I don't mean to say it's always that, but it's good to expect that this is going to be an easier transition, and if it's not, to deal with it. But when you do studies, just the thought that you're being treated, the thought you're taking care of yourself often corrects the hot flashes. And there's so many nice food factors like flaxseed, things that can be very helpful, black cohosh, lots of herbal preparations, some of which we produce and make available to women. So there's so much you can do to help this transition.
Kind of like a combination. We have to sort of approach this with a combination of tools in our toolbox.
Right.
And I think you're all saying stress is a huge factor. And I think stress, Sharon, what you said at the beginning about it, is, you need to have sort of these regular patterns in your life, eat at the same time, sleep at the same time. And when you're stressed, you're not doing any of those things. You're not eating right, you're not sleeping right, so it's just going to make the whole thing worse. So Mary, I want to just expand a little bit. I want to go on to the next question. You were talking a little bit about sort of the how our hormonal production change, our sex production, hormone production changes. Why don't we just replace the hormones? Because that just makes sense. They're going away. I'll just put more in. Why can't I do that?
Well, I tell you, in today's world, in our Western medicine conditioned world, that's a really appealing thought. Give me the pill, give me the hormone, give me the bottle of something that's going to make it all go away, and I can keep living this crazy lifestyle without routine, without doing all the things on my to-do list that I know are good for me. Just give me something that'll work. And certainly there is a place for hormone replacement therapy, especially women, younger women who have had their ovaries removed, where the drop in estrogen is dramatic and very sudden, or radiation, or sometimes autoimmunity that affects the ovaries. So there can be conditions in which the level of estrogen really drops radically, and those women suffer tremendously, not just with menopausal symptoms, but they tend to start having thinning of bone density to such a degree that it can be very dangerous for osteoporosis down the line. So there's certainly a place, and for a large number of women, taking a certain amount of HRT can really alleviate symptoms through that transition. If you do go the HRT route, I think considerations like the form of HRT is very important. Not going with Premarin, which is made from pregnant mare's urine. It may be normal to horses, but certainly it's not to us, and it's associated with a lot more health risks than bioidentical estrogen. And Provera, which is thought to be a progesterone kind of molecule, medroxyprogesterone acetate, it's completely synthetic. And in studies like the Women's Health Initiative, it produced the greatest risk in cardiovascular problems and stroke. And so going with bioidentical hormones, going with a topical HRT in most cases instead of an oral HRT is going to be easier on the body. There's going to be less breast cancer risk associated. For women who have mostly vaginal dryness, thinning of the vaginal walls, pain with intercourse because of the thinning of those tissues, because of the drop in local estrogen concentrations vaginally. For those women, especially if they're concerned about breast cancer risk, taking any form of estrogen, they can sometimes get great relief from taking vaginal estrogen and not taking estrogen anywhere else, and taking such a small dose that it never even raises the blood levels. So I think there's definitely a place with all those considerations in mind a dose and form and topical, versus oral. But I would encourage all women to do everything that they can, everything that we've all been talking about in terms of diet, lifestyle, routine, taking care of yourself, stress reduction, all of those things that are so difficult sometimes because they're habits or they're new habits to learn. But doing as much as you can to take care of yourself in your life, in your diet, in your routine and attitude and so forth before going straight to HRT.
There must be other ways to deal with these hormone fluctuations. I mean, it isn't just the hormones that the hormones are going away. It's that other things are going on with the hormones, the way the hormones are produced in ratio to each other. Sharon, can you speak to that at all, about other ways of dealing with these fluctuations that might bring relief and more balance?
Well, I think building upon what Mary said, it is important to know what type of hormones you're using and to really evaluate things properly. So in my practice, I actually do a lot of work with bioidentical hormone replacement. And it's been my experience that as a holistic doctor, I want to holistically treat women. And I think that for a majority of women, doing the lifestyle changes and adding in the proper bioidentical hormone replacement can really be nothing short of miraculous for them. And as was mentioned in the beginning, our life expectancy used to only be 50 and now it's 80. And so it's really important that we take care to age gracefully. And so I think there's some misconceptions with hormone replacement. I think it's important to really look at sub-physiological doses, meaning just giving a little bit, not taking you back to the levels you had when you were 18. I think in our society we're very scared and we've been somewhat brainwashed in a lot of ways to be afraid of estrogen. And if you really start to think of it, and the same goes for men with testosterone in the prostate, if estrogen was such a leading cause of breast cancer, then when girls' estrogen levels were surging and they were going through puberty and they were growing their breasts, we'd see a high predominance of breast cancer at that point, and we don't. So it's really what happens to the estrogen and how it is in ratio to our progesterone and our adrenal production and our testosterone and everything that's going in. I like to think of the hormones as a symphony in the body. And so everyone's got to kind of toe the line and play in tune or things are going to be out of balance. And so there's some really great tests that you can do, 24-hour urine testing, that not only just show the levels of your blood, of hormones, like if you just did blood testing, but actually show how they're metabolizing and how they're interacting with each other. I think if you are using hormones, applying them topically rather than orally, as Mary was saying, is really important. It's been shown that oral estrogen will raise inflammatory markers in the body. But not just applying them topically, as so many women are taught to do, like on their abdomen, because what we see then is what we have is like dermal fatigue, meaning the hormones start to get stuck in the skin and they start to downregulate the receptors. So actually applying them to the vaginal mucosa, we see that they're absorbed properly. We can use lower doses. So I think there's a lot of misconceptions out there, and I encourage you all to really get educated, ask the questions, and don't stop searching until you find what's going to work for you. So I don't know if that answered your question or not, Joan, but that's my little tangent.
So I do want to sort of, before I go on, I have a question coming up specifically for Susan, but I do want to go, what about herbal preparations? How can those help? I mean, we've talked about some pretty serious prescriptions here, but let's talk about briefly, how can an herbal preparation help?
Well, I think it's a stepping stone. So absolutely, before you go to the hormones, herbal preparations such as black cohosh, even using evening primrose oil, there are a lot of different things you can use. Vitex to help with progesterone production. And those things should certainly be tried first. So it's kind of like, look at your lifestyle, look at your diet, look at the vitamins you're taking, add in some herbs, and then if those things don't work, then you can progress to the bioidentical hormones.
That's very interesting. So there's really a lot of options for us to consider. Susan, I wanted to start with you specifically. What other things are going on as we near menopause? What other things should be concerned about with our health as we get near menopause?
You know, I'm happy to talk about bone. We at the Center for Better Bones, we really deal with bone, but I got to talk to Sharon's point. You know, for many years, we have studied estrogen, and we are advocates of a physiological approach, a natural approach. We know that for some reason, nature limited exposure to estrogen at 50, and that's because it's very proliferative. We know that it's cumulative lifetime exposure to estrogen that's related to breast cancer. And this is going to be fun, Karen. We could, Sharon. I have yet to see any study that shows that bioidentical estrogens are any safer in certain sense, but not as far as proliferation of tissue. They may be a little more protective of the heart. In other words, we really champion working with nature, and even the drug companies themselves say use these hormones only because of the shortest amount of period, because the studies are very clear that the long-term effects are often extremely deleterious, and it's very hard to avoid excess proliferation. So we're really champions of using natural means to rebalance those hormones. In those severe cases where people need to use hormone, that's fine, but we see way too many people developing breast cancer taking hormones. Particularly, it's a very bad idea to do it for bone health because you have to use it lifelong, and the risk is too great. So that being said, and it's kind of every woman has that choice, but I think we should look carefully and think about, do we want to work with nature? Do we think that we can kind of do better than nature, saying, yep, lifelong exposure to estrogen is a very beneficial thing. So, okay, now osteoporosis, this is one thing we should definitely think about when we get into menopause. The average woman loses 10% of her bone mass the first 5 years before the last period and to the first 5 years after. In that 10-year window, you lose about 10% of your bone mass. So, and much of the bone is lost in the first year before the last period. And so you can't tell when that's going to happen. So as you start getting your regular periods, as you start thinking about perimenopause, things get a little unusual. You really want to do a strong bone building program if you haven't done it already. I will add an interesting caveat. Thin women lose much more. Many thin women lose up to 20%, particularly thin, worried women. So you want to pay special attention if you're thin and worried. And of course, we have a lot of information on Center for Better Bones, tests you can do to find out how much you're losing, these bone markers, this NTX test in particular. So there's a lot you can do to kind of seize that opportunity to develop peak bone mass, to try to maintain your peak bone mass and maintain bone density. The last thing I'd say is the average woman, as you go like from 35 to 85, you will lose 45% of your bone and 45% of your muscle if you don't do something special. And so that something special is working to preserve muscle and bone. You lose muscle and bone together, great time to take action at menopause if you haven't done it before.
Mary, do you have other information that women should be concerned about, things, other health issues?
Yeah, I do. Let me first respond to Susan's comment about thin women. I'm a thin woman who worries. And my bones are thin, so I can attest to that. But I think it's interesting, and the explanation for that is very interesting. Some people might not know about, and that is that a major source of estrogen production is fat tissue. So the more fat tissue we have on our bodies, the more estrogen we're going to be making, and the more everything supported by estrogen will benefit. So other
fat has a good use to it.
Yeah, but there can be a whole hour-long round table about fat because
you will have it
because there's fat and then there's fat, like the apple shape versus a pear shape,
right.
And one thing that happens, and this dovetails nicely into your question. One thing that can happen postmenopausally is that we have changes in our fat distribution. And this can even happen within women, where there's less fat deposit on the hips and the thighs and more fat deposit in the belly. And the more stressed we are, the more that happens, because we have, I think, 4 times the number of cortisol receptors in our deep abdominal fat than we do anywhere else. So whenever we get stressed, our bellies work to make more fat. And then that fat, this is why where the fat is makes such a difference. Belly fat, the apple shape, is dangerous fat, unlike fat on your hips and your thighs. So that fat is, we think of fat as, something we chop off the meat if we're making a beef dinner or something, just an inert glob of blubber. It's not that in the system. It's very active tissue. So abdominal fat, especially that deep visceral fat, is producing what are called inflammatory cytokines, which promote inflammation anywhere in the body where there's a susceptibility. It increases cardiovascular risk. It increases insulin resistance, which increases diabetes risk. So these are very significant risks with menopause, and stress factors right into that. Cardiovascular risk goes up. A man is going to have much higher risk of an incidence of cardiovascular disease until the 4th or 5th decade, and then women catch up to men. And by age 65, a woman's cardiovascular risk is equal to that of a man's, and is responsible for a huge number of deaths among women postmenopausally. So a big reason for that is that estrogen is protective. It keeps our blood thin so it doesn't clot so easily. It helps get rid of the bad cholesterol, the LDL cholesterol. It inhibits the breakdown of the good cholesterol. It keeps inflammation down in the cardiovascular system. So cardiovascular risk is very real. And cognitive impairment, I think, is a big one. I mean, memory. I'm sorry, what were we talking about? Memory problems can become very, very challenging, because estrogen helps build acetylcholine, our main thinking neurotransmitter in the brain, and it increases oxygenation to the brain tissue and other mechanisms. So when that estrogen really goes down, and especially if our adrenals are not picking up the slack like they should, if we haven't had chronic stress for years and years and years, to provide more precursors to estrogen, then cognitively we can really suffer, and our risk of Alzheimer's and other forms of dementia goes up. So there are significant health risks associated with menopause, even though we can also embrace, like we've been talking about, embrace it as a new phase in our lives that can have a new meaning for us, and to approach it in a very positive way as well, which can only do us good health-wise.
Right. When we talk a lot to women on the phone here who are going through menopause, and so many of them are dealing with some of the things you've talked about, pretty serious health issues, menopause symptoms, weight gain, a lot of weight gain issues. But we do find that women really, really latch on to the advice we have for looking good in menopause. Do you each have a little nugget for women to how they can look their best in menopause?
Dress in layers.
Sharon, would you like to start that?
How can you look your best in menopause?
Yes.
Well, I think, it starts internally. It starts with looking in the mirror and appreciating what you see and loving what you see. I think it's moving your body. There's been studies shown that women feel their sexiest after a workout. So I think that's another really important thing to do. I think dressing and feeling comfortable, and really taking care of the symptoms that are plaguing you, if there are any symptoms that are plaguing you, so that your body feels good and is not dragging you down. It's hard to really feel and look good if you're suffering with headaches or you feel fat and flabby. So I think also being realistic, having perception. I had one patient once say to me, You know, I love my hot flashes. I call them my power surges, and they're a way of my connecting. And I think that, you know, sometimes if we do gain a couple of pounds, just realizing that it's okay. We can love our hips, and we don't have to be a size 0. That's not really what's really out there. I was just at a TED Talks last night. It was all about sex, and there was a great speaker talking about how we're just brainwashed that 95% of women don't look like the 5% of women that the media crams down our throat. And most of the women that we see in the media are actually airbrushed. And so learning to accept and be present and appreciate who you are and not having a fake ideal to try to live up to, I think is a really good idea.
I think that's wonderful, Sharon. That's such great advice. I mean, everything you said, but the body image piece, that's what first flashed into my mind, because as we get older and hit menopause, and we have been conditioned in our society to think of now being over the hill and not looking good anymore, and just the youth-oriented society. I think with menopause, it's a great opportunity to really practice loving our bodies. So, because we're only going to get older, we're only going to get more postmenopausal. And so if we're judging ourselves now, it's only going to get more so most likely over time. And so practicing in whatever ways work to love ourselves, to love our body image. And I think, like Sharon was saying, physical movement is a great way to do that. Eating well, managing stress, but really learning to think of ourselves as beautiful, even though we're, you know, over 50 or whatever.
Right.
I think that makes a big difference.
Susan, do you have anything to add? I mean, what do you think about that?
Well, my colleagues have said it all. I think that it's happiness is the essential internal quality that leads to beauty, and so it's very good to see what has blocked me from being happy. What really feels good to me. How do I discover that inner joy within me? And it can take so many different pathways. A lot of people, exercise will feel great. Some people getting a special facial treatment makes, it's such a difficult question to see what any individual with a pathway to happiness. But to me, happiness, joy, that's where the beauty comes from.
Well, I think that's all very inspiring advice for those of us who are coloring our hair or doing whatever it is, which I would imagine you probably all think is okay too, whatever it is that makes you feel pretty and good. But I like the fact that the real source of our beauty is inside.
Right.
So I think to wrap up, I got one more question, and I just wanted to ask you, how do you help your patients and clients not just survive menopause, but thrive in menopause? And I know we've hit on a lot of points, but do you have any sort of neat and tidy little package with a bow that you can leave us with about how a woman might look at menopause differently as this wonderful time in her life, this second chance, this opportunity for happiness?
I don't think I have anything to add that's not been talked about. There have been so many great ideas tossed out. So for me, it's really the constellation of self-care, self-nourishment, self-support, which helps to foster a positive attitude going into menopause, a better attitude about this transitional time. But self-care, self-love, self-nurturing, surrounding ourselves with community, maybe also looking at this as a time to really be there for ourselves as women in a way that maybe we haven't been up until now, and we've been busy taking care of everyone but ourselves. Let this be a time to take care of you. And I think out of that allowance, out of that self-permission, all sorts of health benefits can come.
It's good advice.
Yeah, and here at the Center for Better Bones, we have developed a little formula for people who want to use menopause and a concern for bone health as a time when they're going to make significant changes, develop a plan for the second half of their life. So the Better Bones, Better Body program is really a great program for the person who says, I want a little structure. I want a structure that's going to help me with nutrition, with lifestyle, with exercise, with the alkaline diet, kind of focusing on bone, focusing on menopause. How do we make that transition smoother and develop stronger bones, better muscles for the rest of your life? So that's an easy program. If a person says, give me a program, the Better Bones, Better Body program would be great for them.
I like that. Sharon?
Well, I tell women to celebrate. I tell women to come home to themselves, whatever way that may mean. I love the idea of the red tent, which is a native tradition of when you are on your period, that you go to the red tent and it's a time of quiet, a time of introspection, a time where others take care of you. And I think part of the problem why we have so many hormonal issues in our society, in the Western society here, is because we don't sit in red tents, we don't stop and nurture ourselves, and we just go and push through our hormonal cycles. So I remind women that now when they stop losing their blood, that they're actually retaining it, and with that they're retaining their wisdom, and they should embrace becoming a wise crone. And I've led ceremonies for women to help them step into that new meaningful role. I tell them to get out there and dance, to go back and discover what they set aside when they were busy raising a family, to find their passions, that it's never too late. Climb that mountain, learn that new dance step, pick up an instrument, start painting, whatever it is that they set aside, that now is the time for them. And of course, I tell them to have a lot of sex with themselves and with others.
I was wondering when you were going to be talking about that in this discussion, so I'm glad you found a place to fit it in.
I wanted to keep you guys waiting. Figured I'd save it for the end.
Well, I think that certainly would be a measure of how well you were thriving, but just one of them, certainly. That's all the time we have for today. I want to thank all of you all for this great discussion, all this information, and it's really invaluable advice for women who are hitting this point in their lives and are confused or just don't know what's going to happen, or they're really worried. We want to thank our viewers for watching Women's Health Network's Hangout today with our favorite medical experts and practitioners. Make sure you subscribe to Women's Health Network YouTube channel, and definitely follow Women's Health Network on Google Plus so you can join us for future Hangouts on additional health topics for all of the topics that really matter to most to women. Thanks very much, and we'll see you again soon.
Bye, everyone.